Good day, friends. I am Dr. Sandeep Suri, working as physician and diabetologist at Holy Health Hospital, Hisar, Haryana. I'm going to talk about very common scenario, very common symptom, acid peptic disorder. And patient usually comes to us with burning in the retrosternal area, or there is epigastric fullness, or there is something burning, or sour water coming out in the mouth, or you call them heaviness in the chest, or burning in the chest, or the pain in the chest, or epigastric area or upper part of abdomen may be happening with the food or may not be associated with the food, but very commonly when it is associated with heavy intake of fried food, that leads to these type of symptom. So why this happens, how this happens, and what are the remedies for acid peptic disorder? So first we have to understand what is an acid. Acid is basically, acid is in stomach. It is normally produced in each and every human being. This is hydrochloric acid. This is produced from certain cells in the stomach under the response from gastrin. And there are certain important functions of this acid formation. Number one, this leads to breakdown of protein and converts them into smaller molecules or breakdown into more easily digestible protein molecules. Number one. Number two, it leads to a change in the food in the form of gel. It makes gel formation of the food, and so that it can be propelled through the pylorus, going into the small intestine, where it can be moved with the peristaltic movements, and it can be digested. And third very important function is that this hydrochloric acid is a protective phenomenon. It's a protective. It protects us from the bacteria. It hydrolyzes. It clears the bacteria also. So it's these three important functions. But importantly, this hydrochloric acid can damage the gastric mucosa, gastric epithelium also. But for protection of stomach, protection of gastric epithelium, there is a 3 to 6 millimeter thick mucus layer which doesn't leads to entry of or contact of this acid with the gastric epithelium. But once this mucous epithelium is broken or it is somewhat penetrated or the formation of hydrochloric acid is more round the clock, this can lead to acid peptic disorder. There are various consequences of acid peptic disorder. If you start from above, it can lead to bad smell in the mouth, it can lead to caries of teeth, it can lead to laryngeal or voice damage, it can also lead to aspiration of pneumonias, it can lead to bad quality of life also, and also poor enjoyment of the food. And then it can be very distressing. Sometimes it can lead to pain in the retrosternal area, and sometimes this mimics like coronary or myocardial infarction or ischemia type of pain. So these type of things can be seen, and once it can, if it is increasing in duration, it can lead to peptic ulcer, and this ulcer can even perforate, and you can have gastric perforation also. So these are catastrophic issues that can be linked with simple acid peptic disorder. Now, how to manage? So we have to do lifestyle changes. Number one, we have to be regular with our meal. Consumption of the food and regular consumption of the meal, not skipping the meal, small frequent meal, every 2 or 3 hourly small frequent meal, not consuming large meal, avoidance of fried and fatty and spicy food, and also junk food and fast food from outside vendors. That has to be stopped. Also, you have to stop the smoking and alcohol intake and long-term use of NSAIDs or painkillers. They have to be stopped. Also, you have to change your lifestyle and make yourself more active. Sedentarism has to be stopped. So you have to be more active. You have to do some physical activity also, some regular exercise. Try to maintain body weight roughly around 5 to 10% less from the present body weight. Try to reduce your waist circumference. They have got very good metabolic consequences and lead to very good metabolic milieu in your body, and better control of, if you are having hypertension, diabetes, and other issues, they will be very well controlled. Also, if you have got snoring or obstructive sleep apnea, that will be also very well controlled by simple these lifestyle increasing fiber in your diet, more roughage in your diet, and consuming less calorie dense food. That is the beauty of lifestyle changes that can give you these type of benefits. Also, there are certain medications. Number one, there are proton pump inhibitors like omeprazole, lansoprazole, pantoprazole, vonoprazole is recent addition, and it is much more safer and long-acting molecule. There is also histamine blockers in the form of Gintac or Rantac. They are also available, and also certain soothing agent or healing agent in the form of sulfate. They are also available in the form of liquids or gel form. Can be taken. But long-term consumption of PPIs or histamine blockers or even sucralfate can lead to damage. So you have to consult your doctor, stress on your lifestyle modification, that is very very important, and use those safe PPIs, and also those PPI which don't have any interaction, because certain PPIs, they have got drug interaction with certain antiplatelet drugs which are very important for your heart. So you can have consequences, you can have problem with that. So try to go to the newer PPIs, because these newer PPIs, specifically vonoprazole, this is very effective, longer duration of action. You can take it without consideration of meal any time of the day, no need to take in empty stomach, and you can even stop after taking few days and or few months, of course. Also, sometime we give H. pylori treatment also for treatment of peptic ulcer disorder, and that is also very important. And if the symptoms are persisting and you are not feeling any benefit, or it is worsening, you are continuing the therapy for 2 or 3 weeks, then you have to go for upper GI endoscopy and consult your gastroenterologist, so that you may not be missing something dangerous which is happening inside your stomach. Thank you for the patience.